And I am going to give a little training about transportation tools for Northern Colorado case managers and social workers. So this training includes kind of the basics about transportation and social services, how to connect your client to your services, and just general mobility service terms. I'm also going to go over RideNoCo, the call center, our website, what we do, how we can provide information to you and your clients, as well as I will demo the trip discovery tool, which can show you some mobility options here in Northern Colorado. I will also go over some mobility tips and tricks, how to stay in the know about mobility in Larimer and Weld counties through our NFRMPO quarterly mobility newsletter. Opportunities for collaboration if you're particularly interested in mobility in Northern Colorado, and then some of the common questions that we receive from our partners. So, as a case manager or a social worker in Northern Colorado, I'm sure you are connecting your clients and patients to important and necessary services and resources. As I'm sure you're very aware, transportation can be a huge barrier for your clients to get their needs met, whether it's getting a patient into a clinical appointment or ensuring that basic needs are accessible, like food, or if your clients have unstable transportation, which impacts their ability to access employment and housing. Everyone needs to get from point A to point B, and all of these different services from safety, food, physical health to housing. Ultimately, transportation is also playing a role. Um, Lack of transportation can have a huge consequence on a person's health, finances, ability to live independently, and their overall well-being. If somebody is consistently not showing up to their medical appointments, then it's much more likely that a severe medical condition can go unnoticed until it's at an urgent and bad situation. Um, and also having clients consistently not show up to appointments or cancel at the last second due to the lack of transportation can cause larger issues in social services and medical institutions in their ability to be efficient and serve all clients. So I just wanted to quickly go over some of the mobility service types so that we're just on the same page as I'm talking about our providers and mobility services here in Northern Colorado. So I'm not going to go into the level of detail that's on the slide. Maybe take a screenshot if that's helpful for you. Demand response services respond to people's demands. They pick up and drop off passengers in locations according to passenger needs. This could be taxis, volunteer driver services, even buses are sometimes demand response, and other vehicles like bike share or scooter share. The level of service, the kind of the way we talk about this is there is door through door demand response services that have kind of the highest level of patient um, one-on-one care with a patient. So that would be going into somebody's home, helping them get out and into the vehicle, and then vice versa when they arrive at their destination, going from the vehicle into the destination, like the medical clinic or etc. A lot of our services that we see are more door-to-door services where they can assist the passenger between the vehicle and the door of either the passenger's home or their other destination. The most common paratransit type service is what's called curb to curb. The vehicle would pick up and discharge a passenger at the curb or driveway in front of their home or destination. They do not get out of the vehicle. And I also wanted to note that you might hear dial-a-ride service, which is another term for demand response, as well as call and ride is another term for demand response. Then we also have what we call fixed route services. So this is like a traditional public transit service that run on a regular scheduled route with fixed stops and no deviation. Often this is what you see like a printed schedule and timetable with designated bus stops. There are both local fixed routes, which would be within your community, whether that's Fort Collins, Loveland, or Greeley. And then there's also regional fixed routes that would get you between these cities and communities. And finally, non-emergent medical transportation, also called NEMT, is transportation to and from medical appointments that are not emergencies. So, obviously, needing to go get a vision exam, regular type of medical appointment, a physical, etc., that would be non-emergent medical transportation, whereas somebody having a heart attack would obviously be an emergency where they would need more responsive transportation, such as an ambulance. So now that we kind of are on the same page about our terms, I just wanted to go over there. These are all the different mobility providers that we regularly work with at RideNoCo. Um, Obviously, there are a lot of providers, and all of them have different service details. They serve different clients. They have different eligibility requirements, and it can be kind of overwhelming to fully figure out which providers can really meet the needs of your clients. And that is the number one benefit of what RideNoCo does is we work with all these providers. We know what their eligibility requirements are. We know when they can give rides, when they can't give rides, their service boundaries, etc. So instead of, as a case manager, feeling like you need to know the ins and outs of every single provider, we are here specifically to help you and your clients with that information. So now I'm going to jump into RideNoCo and what we do. We provide personalized transportation information through our website, call center, and our trip discovery tool, as well as things like our training opportunities, such as this video. We have what we call mobility specialists that answer callers' questions about transportation providers and connect them to the transportation that best meets their needs. On the back end of things, we coordinate our transportation providers and our community providers and partners to improve mobility outcomes in northern Colorado. We are housed in what's called the North Front Range Metropolitan Planning Organization, which is the regional transportation planning agency. So we really are the connector between these transportation providers as well as long-term transportation needs and trying to fill some of the mobility gaps that we are aware of in our region so people can have a better quality of life. So this information on the screen is about our call center. Our phone number is 970-514-3636. We are available Monday through Friday, 8 a.m. to 5 p.m. And I would encourage that if you ever get a voice mailbox, please leave your information because we will call back within one business day. Often we will call you back within an hour. Sometimes we are in meetings and are unable to pick up the phone right away, but we do provide a high level of service once we are able to speak with you or your client. Additionally, we have live translation services through Language Link. So if your clients do not speak English or are more comfortable using a different language as their primary language, we do have that as an option so that the communication is clear and they get all of their answers, all of their questions answered. We also have a website that is obviously available 24/7 to kind of browse all of the transportation providers in our region in one place. That website is www.rideno.co. Kind of an odd URL, but basically it's www.rideno.co. I will do a demo here in one moment on how to really review and use our website as a case manager or social worker. This can be a pretty powerful tool in cases where you don't think a high level of one-on-one information is needed. You just want to browse what options are available by community or by, for example, population served. There's a lot of filters in our Explore Providers tab, so that's a great way to really view what options might be available for your clients. We also have language and accessibility tools on our website. So here on the right side of the screen, you would see this accessibility tools little guy, this blue guy. If you click on that, all of these options come up, and I will also demo that here in a moment. Like I said, our website was translated into Spanish by a local translator. You can access the Spanish translation on the top right-hand corner of the website. There's this drop down, and you can click Espanol as the option. Um, our website is also very accessible via a web browser on your phone. It adjusts the settings so it looks nice on your phone. So this website is accessible both on your you know, desktop, tablet, or cell phone. Additionally, we do have additional language options outside of Spanish and English. It's essentially a tool through Google Translate. It's at the bottom of the website, and then you can click select language. Obviously, because this wasn't translated by a local or an actual person, the translation might not be as good of quality as the Spanish translation, but we just wanted to offer more tools to people so that our website could be accessible to anybody. So, something that we're really excited about is we developed what's called a trip discovery tool. It's a first in the nation tool that you can browse the available transportation options and plan trips on both public transit and volunteer transportation providers. Um, the URL for that is discover.ridenoco. I'm going to really quickly exit the PowerPoint and show you all the website. So you can get a feel for how to look through things and what might be useful for you as you're helping your clients. So this is our landing page. There are a couple different ways to browse options. You can scroll down here and filter kind of by type. So we have public transit, older adults, wheelchair accessible, and commuter options. Additionally, you can filter options by community. So Fort Collins, Loveland, Greeley, Windsor, Berthoud, and Johnstown, for example. And then we just provide some more information about what RideNoCo is. My favorite way to filter options is to go to the Explore Providers tab. This shows automatically all of the providers. So you can scroll and see every single option that we have on the website. You can also filter with this little box here. So let's say I am looking for nonprofit and volunteer options in Weld County. So I'm going to search providers now with this blue button. And it just shows you the nonprofit and volunteer providers in Weld County. Then you can click on these little plus symbols to review more about that specific provider. So, for example, the American Cancer Society has a program that's called Road to Recovery. It's a volunteer driver program to take cancer patients to their cancer-related appointments. So, in the service details, we go over the area served, what their website is, what the phone number is, and then details about that program. Eligibility. So for this program, you have to be a cancer patient going to a cancer-related appointment. And if you're under 18, you need to have somebody accompany you. All of our providers, it goes over the fares. So this is a free resource for cancer patients. And then any kind of service hours or other details. So this, it just says it takes several business days to coordinate a ride. So please call well in advance of your appointment date. A lot of our demand response providers need a good amount of notice, so we provide that kind of information. Another provider, just to see really quick, is 60 Plus Ride. So again, it talks about area served, their website, their phone number. And for example, here, for eligibility, clients must be Weld County residents age 60 or older who can walk to and from and get in and out of a vehicle with no more than an arm assist and or a light walker. Right now, 60 Plus Ride as of May of 2023, excuse me, March of 2023, does not have a wheelchair accessible vehicle in place. So that's why they have this eligibility requirement. We work very closely with these providers. So when those types of service details change, we update that in our website and other materials. So yeah, that's just an example about how to filter the options. I want to clear my search and look at all of the providers, so I just click on the Explore Providers tab again. And let's say you want to look at public transit, details for Greeley Evans Transit. Again, it provides all of this different information about where they serve, their website, contact information, etc. For some of our providers who have regional fixed routes, we at the bottom talk about these specialty services like the Pooter Express that goes from Greeley to Windsor and Fort Collins on weekdays. Greeley Evans Transit does have a small fare, so it goes over what those fares are. And then paratransit has eligibility requirements, whereas fixed route does not. So we talk about that as well. So this is just a good way of, based off of where your client lives, you can see what providers operate in that area. Yeah, so that's the basics of RideNoCo. We also just have some about information, as well as if you're interested in getting involved, we have mobility committees and information about travel training on our website. We just really try to be a hub of information related to transportation in Larimer and Weld County. So this is kind of your place to check out when you're looking for those resources. Now I'd really like to show you the trip discovery tool. So the plan long term is that it will be integrated into our website on this front page. But right now, you just have to click this link that says show me the trip discovery tool, and it will take you to a separate web page where you can plan and review options based off of a start and end location. So let's say that I am a resident in Greeley, and I'm looking to get to the Northern Colorado Medical Center, for example. Just for this example, you can either type in the address here, or you can zoom in on the map on the map side of this and click where your start location is. So I'm just going to use an example of, let's say I live on 12th Street. This is not where I actually live, but I'm going to pretend like it is for this example. I'm going to say I'm planning a trip from here, and then I'm going to enter the destination that I'm going to. So I'm going to the North Colorado Medical Center on 16th Street. So after I click where I'm starting and where I'm going, I can provide a little bit more specific information. So let's say I'm leaving now. That's the automatic setting. You can also depart at a certain time. So let's say my appointment is at 8:05 a.m. on next in like a couple of weeks. I can make that filter what options are available based on the exact time myself or my client is going to their appointment, so that if like let's say a bus appears to be an option, but if you had actually changed the exact time that you're departing or trying to arrive, um it might change which options it actually gives you, because sometimes buses don't run on certain days, or you would need to leave earlier to make sure you catch the right bus, for example, if that's the type of information you're looking for. So I just click the refresh button to show those options. So it's recommending 60 plus ride, or driving and taking a public transit route, or it shows how long it takes to bike, walk, or drive. Not really sure. And if you see bugs like this, please let us know, because obviously driving there would not take 31 minutes. You can also go into the settings, and if you or your client is okay with more walking, or you want less walking based off of ability, you can also it might adjust what shows up based off of this little tool. So I'm going to look into 60 plus ride. Let's say I know my client is 65 years old, and it seems like this could be a good option for them. So it provides some more details about eligibility requirements. So in the trip options or the trip details, it says, to take this route, you must call this number at least 7 days in advance. And then more details, it says, this trip includes flexible routes, demand response routes. 60 Plus Ride is a volunteer transportation service operating in Weld County for residents 60 years or older who can walk to and from and get in and out of a vehicle with no more than an arm assist and or a light walker. To register to schedule a ride, call this number at least 1 week in advance or 1 day in advance by 3:30 p.m. for non-medical Greeley Evans service. So this just provides those trip details about how to access this flex route, which is a little bit more complicated than just hopping on a bus at a bus stop or driving yourself. So that's an example of how you can use this this trip discovery tool. Let's say I want to do a different option, maybe a regional option. Let's say I live in Berthoud. I'm just gonna do like just outside of Berthoud, just as an example. Let's say I live like over here. Just gonna say I'm going from here, and then I'm going to the McKee Medical Center in Loveland. Something that we did is we created a list of medical and human service agencies that will populate first in the search bar to hopefully help connect clients to human service providers such as yourself. So it's showing driving and taking transit. Let's edit this slightly. Let's see, maybe over here instead as the start location. So this tool is still pretty new, but I would anticipate that this would show raft as an option. I don't know why it isn't. Maybe it's too early. Let's try like 12 p.m. Yeah, okay. Sometimes it's finicky about things like that, so just to warn you. So it's going to recommend raft. Again, this is what they call a flexible route. It's a demand response provider. So it's saying in order to take this route, you need to call this number at least 3 days in advance. And then provide some more information about Raft, which is a volunteer driver service. So yeah, that's a little demo on the trip discovery tool. Another way to use this is you can just view routes, which like if you wanted to see the 60 Plus Ride service area, it shows all of Weld County. And then let's look at BAT service area, for example, or Raft service area. And they have outer destination areas that they will also go. So you can just explore things like that. If you're interested in more public transit routes, like fixed routes, this has routes from Greeley Evans Transit, Transport in Fort Collins, the City of Loveland Transit, RTD down in Denver, and even has the Rocky Mountain National Park shuttle. So it's pretty comprehensive for the public transit routes. I'm just going to use this example as you can see exactly where all the bus stops are for this specific routes. So yeah, that's the basics. I'm going to finish this presentation now. So the last thing I wanted to tell, human service providers like yourself are a few mobility tips and tricks. So obviously, like I've hopefully reiterated, RideNoCo can really help you evaluate the mobility options and even provide travel training for clients and go into any questions they have. Sometimes there are multiple providers that can meet a client's needs based off of different situations. Maybe a client can use a service like Saint Volunteer Transportation within Fort Collins, but when they want to go down to Denver for maybe like a medical appointment or even just to go down to Denver for social reasons or recreational reasons, we can talk through what the bus staying is, which is a fixed route service between Fort Collins and Denver Union Station. So we can really go into, a couple different options and answer their questions about those services. Another tip and trick that I like to tell people is, the further away their medical appointment is, or the services they need are, the more expensive or the less likely there is to be an affordable transportation option. A lot of our services for older adults are based off of volunteer drivers, so those volunteers might not be as willing to pick up rides that are for really long distances. So if there's a way to schedule your client at a clinic or an office that is closer to their home, that's better. For example, if you have someone who needs a vision appointment and they live in Berthoud, instead of scheduling them all the way in Fort Collins, maybe there's a clinic in Loveland that's a little bit closer, or Johnstown, that might make it easier for those service providers to get that client where they need to go. Or if there isn't a non-commercial option, which certainly happens sometimes, a taxi will be less expensive the closer it is. If you're working with older adults, many of them might still drive, which is awesome, but I would still recommend telling them to register for nonprofit providers. This helps them stay ahead of their needs. That registration process can take a couple weeks, so it just, when it comes the time where they might need a ride, whether it's just like a one-off appointment where they just can't drive themselves, or if more long-term transportation mobility needs are needed for that client, they're already in the system. It'll be a lot easier for them to access those services. So it's something we encourage folks to do before they need it. And then another thing that can be a resource to people that folks might not think about is clients might have insurance benefits that will cover the ride of transportation. Whether that's through a private insurer, sometimes they have a certain number of rides that are covered per year, or a Medicaid. Medicaid has IntelliRide, that is a free transportation resource for Medicaid recipients. Or if they have a Medicare Advantage plan, sometimes they also have transportation benefits. So encourage your clients to understand their insurance benefits and call and ask if you do not have that information. I also wanted to note that our team at the NFRMPO and at RideNoCo, we recognize that the existing transportation system has gaps that prevent people from traveling where they need to go in Colorado and in our region. A really important part of our program is working with people and our providers to better understand transportation gaps and develop a plan to address those gaps. That being said, please contact us about the needs of your clients, so that we can understand that a little better. You know, social workers and case managers, you're working face to face with these clients every day. You probably have a very good idea of what their needs are, and all we need is to work together to talk about that. So again, here on the screen are some gaps that we see consistently. Um, And if there are additional gaps that your clients have experienced, we would like to know that. So we also have a quarterly mobility newsletter. We work with a lot of these providers to try to expand services, whether it's adding wheelchair accessible vehicles, or adding service to a new geographic area, or filling other gaps that we've identified. So, and we post about this once services are in place, which can take some time, but we keep people updated. So if you're interested in getting this quarterly newsletter, you can email mobility@nfrmpo.org and we will sign you up for the service. If you have relevant news to share about mobility services, please let us know. If you're a medical provider and your medical clinic has transportation services, let us know, because there are certainly a lot of different providers who might not have that information already. And I guess the last thing I'll say about the newsletter is we also don't spam people. It's once a quarter. You'll get 4 emails a year. It's not excessive by any means. Oh, excuse me. And then, as a human service provider, there are so many opportunities for us to work together. Um, so I just list a few examples. We have paper riders guides that are both in English and Spanish and just direct people to transportation providers in our region as well as RideNoCo. It's a good thing to have at your front desk, or when you just discharge patients, or if you have a patient who identifies that they don't have transportation. It's just an outreach material to connect them to some services. We also are expanding our client travel training. Our providers have a whole list of travel training resources that you can look at on our website, but you can email us if you're like, we have this community group that would love travel training. We can try to schedule something with you to make them feel comfortable with the variety of transportation options that exist in our area. We also would love to coordinate with your administrative staff or other customer-facing representatives if presenting to your staff about us and how to identify when somebody might have some mobility needs that are being unmet. We want to be that resource to your staff. Also, if you want to have our number on hand, you can always give us a call when those types of needs come up. And the last thing is we do have 3 mobility committees. So we have one for each county. So we have the Weld County Mobility Committee and the Larimer County Mobility Committee. Both of those meet virtually once a quarter for about an hour and a half. It's just a way of meeting, cross cross departmentally, across disciplines between transportation providers and human service agencies, so that we can have better outcomes, about the things we're talking about today. We also, once a quarter, have a regional Northern Colorado Mobility Committee. We meet in person in Windsor once a quarter for about 2.5 hours. Really, the goal is networking, trying to find solutions to some of the mobility gaps, and understanding what services are currently available. I also just wanted to go over a couple common questions that we get, just to clarify. So, RideNoCo, the one call, one click center that I talked about earlier today, people will often ask if we provide transportation directly, and we do not. We are a free resource to get information about transportation providers. We're kind of the experts in what's available, but we don't directly schedule rides. We will refer your clients to the provider or providers that will meet their needs. Another question we get is, I'm aware that this provider is not meeting our needs. It's consistently not working for my clients. What do I do? It seems like there's no good options. Please let us know. That's one of the values of RideNoCo being hosted in a regional planning organization, is we want to plan for better mobility services in the long run. And we work directly with providers to try to troubleshoot issues that we're seeing. So let us know, and then we can work with the other providers to make transportation outcomes better for your clients. Those are the 2 most common questions I can immediately think off my head, but excuse me. You can connect with our team. Our mobility director's information is right here. His name is Corey Schmidt. Or you can contact RideNoCo directly at either mobility@nfrmpo.org or 970-514-3636, and we would be happy to talk with you. We'd be happy to meet with you to really talk about your clients and your agency's transportation needs. Or if you're interested in joining a mobility committee or hosting a travel training, you can also reach out, and we'd be really excited to do something like that. So thank you so much, and feel free to reach out with any other questions.